I'm Chelsea King, the Executive Director of the Collaborative. Today, I want to share highlights from our presentation about the Upstream Initiative to the State Early Learning Council. The Upstream Initiative is community-driven, and it provides a roadmap to transform how we support families during this critical first 1,000 days of a child's life. Here are a few of the powerful things we heard.
We can surround families, pregnant people and families, with everything they need, helping meet their basic needs. We will see just amazing improvement in especially what we call early relational health, or what we used to call attachment. We know the earlier that we invest in the prenatal and first year of life, the higher that rate of return on investment.
The work of the Upstream Initiative has been inspired by two things. One, the evolving science about the brain development in children. And secondly, the reality that most of the factors that ultimately determine the success of children and families are ultimately local. Pregnant women and very young children who struggle every single day with the uncertainty of knowing where they can access their most basic of needs, like a shelter, like food, like safety, live in a crucible of toxic stress that undermines everything we know that brain science tells us about the healthy development of children. Most of the factors that impact lifetime health status occur outside the medical system and in the community, and often in the very earliest years of life. The barriers that prevent children from accessing these basic needs are both financial and non-financial. So our early learning hubs and our child success models are seeking innovative ways to create seamless, continuous eligibility for the programs and services that are funded by state and federal agencies, and by directly providing families with the flexible resources they need to secure these basic needs for themselves.
And naturally, we're very supportive of this initiative. Anything that helps us prevent entry of kids into the foster care system. And naturally, if you're putting investments into building the first 1,000 days that, as John said, helps develop 80% of the development of the brain and the child, we're absolutely supportive of that.
We are excited to move forward as a design pilot to make the system changes that are needed to support families. We know that what works best for one part of the state doesn't always work best for another part, but empowering local decision-making to support local families, that's the shift that systems need to make to really help support our communities. This work will take time and it will require perseverance. And our region, we are ready to do that.
Thank you, Early Learning Council, for your support. Together, we can turn these community-driven roadmaps into a strong start for every family in Oregon.